So this screen is going to come up. You're going to press training mode, okay? You're going to keep looking at channels 1 and 2. So channels 1 and 2 correlate with green and blue, okay? So channels 1 and 2, channels 3 and 4 are yellow and orange, okay? You only have to worry about channels 1 and 2 for master reset, okay? So I will show you electrodes in a second, but as far as settings, so once my patient is set up, you want to make sure that channel 1 and 2 is clicked. It turns green. That means that channel 1 and 2 is active, okay? You do not need to mess with any of the settings besides the top box. That is what's going to turn the tingly feeling on for the patient, okay? If for some reason this box is not selected, you just have to make sure that you press it and it should highlight in orange. That means that you're dealing with that box, okay? Once the patient is set up, you are going to turn the button clockwise, okay, very slowly, and you're going to ask the patient to tell you when it's moderate without discomfort, okay? They may feel it in the neck first or in their feet, okay, or they might feel it equal between the two. Every patient is different. That is okay. If they feel it more in their neck or if they feel it more in their feet, that's totally fine, okay? You just want to make sure that their muscles are not contracting, okay? They should be relaxed, okay? Because if not, there will be sore after newbie, okay? So if they come in and tell you, well, my neck was really sore, the intensity was too high, okay? It should just feel nice and pulsating, okay? Their body will get accommodated to it, so it might decrease the sensation. So you come and check in then with them halfway. Hey, do you want me to turn it up? If so, they can, okay? Emergency stops. If for some reason some person gets freaked out or it's too much for them, click the channel button. It will shut the machine down, or if all else fails, you just turn the power off in the back. Okay? Emergency stops.
And what at least just do click or something?
You can press down on this button. I don't like that because sometimes it doesn't stop it. So.
I don't like that one either.
Okay.
Okay, good.
All right, so is everybody cool with settings? Okay. There is a way to set the 10-minute too, which I'll show you right now. Or if you feel like that's just too much for you to do as far as settings, just keep time on your watch. Okay, so I'll show you that real quick before I show you pad placement. Okay, so again, training mode. Okay, I'm highlighting channels 1 and 2, okay, which is my green and my blue channel. I've set my patient up. If I want to do the timer, I click the first box. You can go to 10 minutes, okay, and then you click this channel and then see how it starts going down in time. You just have to make sure that if you're turning it up, like if the patient's like, oh, I really don't feel it again, you need to make sure that you're only on channel 1 and 2, okay? If not, it will be on both channels, okay? So whatever channel you're working with, which should be just 1 and 2, it should just be highlighted green. Does that make sense to everybody?
Yes.
Okay, cool. All right. Then the timer will automatically bing when it's, and the machine will shut off as soon as it hits 10 minutes, okay? If you want to add more time, you can by just clicking the box and upping the time, okay? If the time's too complicated, like I said, just keep time on your watch, okay? All right, so let's go over setups, okay? Okay, so you're gonna take.
You've never done it, right?
I did.
Oh, you did do it?
You want to be my patient?
Yep.
Okay. Pads go on the bottom of the feet, okay? They're going to go on the ball of the foot, okay? You want to make sure that it's on there, okay? All right? Boom. Small circular pads. Sit on up for me, please, Heather. Are going to go on the patient's neck. Come see Christine. Okay, right below their hairline. Not on the spine itself. Okay, right on their suboccipitals. Okay. Okay. Stay seated for me. Okay. All right. You're gonna take your green cord. Okay.
It looks like those are coming.
We have a solution for it, don't worry. We got new pads anyway, so those I don't like those. Okay, same color, same side of the body, okay? Don't put green and then blue over here, okay? So you're going to take the black. So black goes on neck and red goes on feet, okay? Hold those for me with your hand, okay? So then I'm gonna put the red one down here, okay? Same thing. Blue is gonna be on her left side. Okay, put in it black. And then, okay?
Can I ask a question?
Yeah, go ahead.
You said blue's on the left. Oh, from here it looks like green is on the left.
No. I'm just saying make sure that it's on one side of the body.
Oh, okay,
It
sorry.
doesn't, yeah.
Okay, gotcha.
So don't put like crisscross.
Right,
if that
I was
makes
looking
sense.
at this machine.
Oh.
I was like, wait, it's the opposite.
No, you're just
Gotcha.
using channel 1 and 2.
Okay.
Okay. So for those pads, we ordered new circular pads that actually stick,
Okay.
but these are what these are for.
Yeah.
Okay. So you're gonna gently put it around the patient.
I was gonna say that looks.
It's actually not.
It's not
It's
uncomfortable.
not uncomfortable.
that
Actually.
was funny.
Okay, and you just ask them if it's okay before you do it. But this is how they do it at newbie, actually. So it's not uncomfortable.
Yeah,
Okay.
it's just a nice soft foam.
Yeah. And then I actually fold the pillow too. Okay. You can go ahead and lay down. So then you see how the pillow rests around those electrodes. Okay. And then you want to make sure that the pads are underneath their knees so they are comfortable.
Okay.
Okay. That is pad setup.
Very nice.
Okay. Tell me when you start to feel the machine. I want it moderate without discomfort. I do not want any of your muscles twitching or contracting, okay? You may feel it more in your neck than your feet or vice versa,
Okay.
okay? All right, here we go. So you're gonna turn it up clockwise, very slowly.
I'm starting to feel it. I'll let you know when I'm
Okay, where do you feel it?
neck more than feet.
Okay,
A little bit in the feet.
Tell me when it's moderate without discomfort.
That's good.
Pretty good there?
Is this the blue one? Yeah.
No, the blue one's over there.
Oh, it is?
Yeah, I'll get it in court. Anyways, okay, so that's where my patient is. Okay, might diminish as you're here doing master reset, which is totally okay, as long as where we started is a good place for your body. I want you to focus on diaphragmatic breathing while you're here, and really relaxing to help bring down your system, okay? I'll come check in with you halfway to see if you want me to turn the machine up or leave it as is, okay? If in the instance your patient only feels it in the neck and they don't feel it in the feet at all, what you can do to see if that changes is you push this button right here. See how it says POS for positive?
Mm-hmm.
You can press that. Does you have any change?
I feel it. It just feels different
That's
to me.
different.
Yeah.
Okay.
But I was feeling
Sometimes
it.
that will switch that for the patient where they'll feel it more equally. I very rarely have had that happen, but just in case if a patient keeps telling you they really don't feel it in their feet, then you can press it and see it. I usually 99.9% of the time keep it on that.
So that pause, what exactly?
That means
does it
positive.
do?
It switches the current.
Oh, got it.
Yeah.
Okay.
So from right now, it's going from her neck down to her feet. It's going
That
from black to
reverses
red.
it.
Yeah, and that switches the polarity. Okay. Again, I've never really had that happen. Lisa's maybe only had it once. But in the case where your patient's just really not feeling it in their feet, you can push that button to see if that changes for them. If not, you're not going to do any damage. You're just trying to see what they feel better. Okay. And then you just give them their essential oil, and they relax. That's it.
Taking it off is pretty much just backwards. I mean.
Yep. So to turn it off, say if Heather's done and you're just keeping time on your watch versus on the newbie, okay, then you can just hit that and it turns the machine off. And then you just take the electrodes off.
Okay.
Okay. Taking electrodes off. Okay. You want to gently take it off their foot. Don't give them a wax. Okay. And you want to make sure that you nicely take this off. Okay, because you can damage it. Okay. So you just nicely take it off. Don't rip it off because then you might rip this off. Okay, and rip the electrode off. You're totally fine to put these here
While you're doing it.
while you're to save
Them
some time. Okay, and then I just put them away. Cool.
And she rises from the dead.
Nice, it's from the
Yeah, I
dead.
look like a mommy there.